Thanks for joining me to learn about your infusion set choices. Choosing your infusion set is one of the most important parts of pumping. The best choice for you may depend on your activity level, your insertion site, or your body type. Each type of infusion set has a cannula. That's a fancy way of saying really tiny tube. It is placed just beneath your skin to deliver the insulin. Let's look at some of your choices, including the Inset 30, the Inset, and the Contact Detach. The Inset 30 is an all-in-one set, which means the insertion device is part of the design. The infusion set is inserted at about a 30-degree angle, which decreases the risk of the cannula coming out, especially if you are an active or muscular person. The Inset 30 has a clear viewing window which allows you to monitor for redness around the insertion site. The Inset is also an all-in-one set. Many pumpers like the convenience of the inserter, the infusion set, and the tubing all in one package. The Inset can be inserted with one hand, allowing you access to more sites on your body. The Inset is inserted straight into the body at a 90-degree angle. These features may be good for pumpers who don't like to see needles. The last infusion set is the Contact Detach. This infusion set is inserted manually. It has a hypoallergenic stainless steel needle, which remains under the skin during use. Unlike the other cannulas, the needle does not kink, so there is lower risk of having interrupted insulin flow. Many pumpers find this set easier to learn and simpler to insert, since there are fewer steps required. Once you have decided on which infusion set you would like to use, the next step is to choose a tubing length, 23 or 43 inches. Choose the tubing length you think will be the most comfortable for you. The 23-inch tubing is preferred by most pumpers. It keeps the pump closer to the body, and it's long enough for many situations. The 43-inch tubing is available if the pump will be placed further away from your insertion site, or if you'd like to tuck your pump away in a pump accessory. Let's review. The Inset 30 is inserted at a 30-degree angle. There's less risk of the cannula coming out. It's especially for pumpers who are active or muscular, and it has its own insertion device. The Inset has the tubing and insertion device all in one package. It is inserted straight in, and the one-handed insertion allows access to more sites on the body. The Contact Detach is a hypoallergenic steel needle set. There is less risk of kinking. It is a manually inserted set, and there are fewer steps. If you would like additional help deciding on the best infusion set for you, please call or email us, and a diabetes educator will contact you.